All right, upper cervical family, it's Dr. Tedder here with my son Owen, about to do karate. But I wanted to share a really quick thought with you about a conversation I had with a patient today. That conversation was about when and why to use upper cervical care. And I was telling him and her that upper cervical care is one of those types of things that it's not a substitute for another form of health care, and it doesn't replace anything. And nothing else can replace it, meaning that that upper cervical care is based on the system and principle of detecting and correcting a subluxation or a misalignment around the upper part of the neck called the brainstem. And when you have a bone that's misaligned on the brainstem, in essence, as soon as that occurs, your body begins to shut down. It begins to function less. Second thing that happens is your organs begin to work inefficiently. And then the third thing is that your immune system becomes destroyed at that point. So your body gets sicker and sicker over time. So what happens is when you have an upper cervical misalignment, your body begins to shut down and perform at less levels. That's good grammar there. It doesn't perform at the level it should be, and over time it has dis-ease. It creates disease over time. So in essence, if a doctor of chiropractic in the upper cervical world finds a misalignment at the top part of your neck, it needs to be corrected. It absolutely needs to be corrected. Now, if you have one that lasts for a long period of time, what can happen is you could have symptoms. You could have headaches, back pain, neck pain, diseases. Your body can perform to the point where it creates disease processes. And so understand that then our job is to correct that subluxation or correct that misalignment, so your body then can do the opposite. And instead of creating dis-ease, it creates ease. And just like it created disease over time, it will create health over time. However, it is not a therapy. It's not a replacement of something else. It's not an alternative health care. It's a separate and distinct process, just like a dentist. I mean, a dentist is not a replacement of a medical doctor or a physical therapist. They're there to correct problems with the teeth. So we're there to correct subluxations, and that's just the bottom line. The way I was explaining it to the patient is that in essence, it's like a flower. If you have a flower, what's the difference between a wilted flower and a flower that's vibrant? It needs one of them has something less than the other. So meaning one, a flower needs good soil, good water, good sunlight, and apparently good love. But if you put a flower in poor soil and have great water, it still can wilt. If it's got a lot of water but poor soil, it's going to wilt. So when it comes to your health and the way your body's designed to function, think of that. Think of performance. Think of vibrancy, meaning that you have to move your body to be healthy and well. You've got to eat good foods to be healthy and well. You've got to have a great environment, positive mental attitude. And the fourth one is you've got to have a good nerve supply. You've got to have a good functioning nerve system and brainstem, because it's what controls and coordinates everything else in the body. And if you have one of the four, you're never going to be healthy. If you eat well and don't exercise, it's not a good thing. If you exercise and don't eat well, it's not a good thing. If you've got a poor nerve supply from the brain to the stomach and your stomach's destroyed and you eat healthy food, it doesn't matter. Your body's still going to produce disease. So remember, upper cervical care is separate and distinct. It's something that needs to be added to your health care, not a replacement of. Also, I want to mention real quickly that this month in January, we are doing our Patient Appreciation Month or Day or whatever you want to call it. And we're here to make our community healthy again. You'll see us around the office wearing our hats and looking goofy. But really, this is a fun event, but it's designed for you to help us reach the people in your world that are sick. 5 out of 6 people are dying of cancer and heart disease. 1 out of every 3 persons is on a chronic medication. People are sick and dying and getting worse as the years go by. They need a chance to be well, and we can't do it without you. So in our appreciation, what we're doing is, in our appreciation of you being awesome patients, is we're donating our new patient exam and x-rays for no charge. So spread the word, get the word out, get them in the office this month, no charge for an exam and x-ray to see if we can help them and see if they have subluxations at the top part of the neck. We love you. We appreciate you. Owen, we out? Owen says we're out. Y'all have a great day.